Today, I want to talk about health readings, something that a lot of tarot readers will automatically say that they don't touch or cover. And if you are in the slightest bit concerned or worried about health readings, then not touching them is absolutely the right thing to do. But what happens if you're reading for other people, whether it's, friends or as a paid professional, and people are asking you for advice about health, and you think, yeah, okay, I want to give this a go. So, this I'm going to demonstrate a spread for myself, and it will be, I haven't done this spread on this topic, so it's going to be a live reading, and I'm going to cover a few basics to think about before you do health spreads. Number one, work out how you're going to communicate what some of the big, bad, ugly cards mean if you are reading for someone else and you're doing a health reading. Because if somebody's asked about their headaches and they get death, they're going to make an automatic assumption. So before you do any health readings, get out some of the more difficult cards. I've just got a handful here, but I would obviously include the Nine of Swords, the Ten of Swords, the Tower, and think about how you are going to explain the name and the image if you're doing an in-person reading and you are showing the cards. Because unless you've got a rock solid way of expressing why this card does not mean what it says it means, you're going to create anxiety in your client, and that is never a good thing. For me, I always say about death that this is a deck based on cycles of life, and that death is just the same as autumn. It is an ending with a new beginning implicit in it, and I will talk about that. I will talk about the sun rising. I will talk about how the Hierophant appears to be embracing death because he understands that this is not an ending, but it's part of a cycle. And I will make it clear that as a very experienced professional, I have never yet, and this is the truth, I have seen death in the cards. That is for sure, but it was never indicated by the death card. So, I am quite comfortable about talking if difficult cards come up. So just make sure you're really comfortable with that. That's the first thing. Secondly, whether you're reading for somebody for the first time or the 200th time, I always say if you are concerned about your health, please see a healthcare professional. I always say that I am reading for holistic support of your health, and that anything I say is complementary to what your healthcare professional has told you. So, if somebody is seeing a doctor, I don't even go near that. No, that is nothing to do with me. I am reading from a holistic perspective, and I am not reading to diagnose. I am not reading to put a client's mind at rest. I am reading for health support. I am reading because I think health is about mind, body, and spirit. And, there is an absolute role here for a healthcare professional. But I may be able to offer some understanding in the role of the mind and the spirit in the ill health, which is wrapped up in the physical health, and I may be able to offer some holistic support to suggest some practical holistic concepts. It might be going to see a nutritionist. It might be, if it was lots of swords cards, it might be to do with mental health, with meditating, journaling, stress. I am looking at health from that angle. I am not stepping into what a doctor or a healthcare professional might say. So that's how I read for health, and I do read for health. So I'm going to put I've knocked my tripod, put my big cards away and pick up my reading deck. And I'm shuffling, and I'm going to demonstrate how I would read for a client, and I'm going to read for myself. I have been suffering from really bad insomnia. I'm sleeping a maximum of 4 hours a night, which is not good for my health. And I'm going to read more quickly than I would a client because I don't want this to take half an hour, but as if I was a client. So I'm shuffling now, and I'm really focusing on me and my insomnia. We just move my book out of the way. I like to cut the deck. You really don't need to. It's about having a routine that works for you. So I'm really focusing now on my insomnia. So the first three cards represent the state of my sleep pattern right now. The Knight of Wands. In this situation, I think the Knight of Wands represents the adrenaline and probably the cortisol, what I would call the stress hormones. And I'm definitely coming out of an extended period of complex PTSD. I am feeling safer, but I think that my cortisol and my adrenaline levels are too high. So that would definitely make sense. The Hermit. I am very reflective. When I wake up at night, I can be agitated, the Knight of Wands, but I can also be very reflective. I find that I'm looking back at life, thinking, why did that happen? Could that have happened differently? I don't get much time to do that in my life because, I'm a full time mum and I work as well. So it is that. And the fool is zero. The fool is new potential. I feel that I am coming to the end of a very stressful cycle in my life and that I am between spaces. I'm not quite at my new cycle yet. So yeah, that feels right to me. So these three cards represent the sort of the past right up to this point. What's going on with my sleep? Looking at the Fool and the Hermit, I do tend to go sort of into quite vivid dreams. I lucid dream. The stuff I think going on with my dreams as well. The next three cards are the most important cards. These are practical advice. If you go to my website, if you go to Tarot Resources, I've got a practical crib sheet you can download with a piece of practical advice for every single card. The Magician. It's about believing that this is a new start. It's about decluttering as well. Look at the Magician. He's got everything he needs and nothing more. I think that my house and my garden are very cluttered, and decluttering I think would really help. There we go. We've got the Tower. If you are reading for someone else, you should better be able to explain this in a positive way. The Tower is letting go at its heart of self limiting beliefs that have created a feeling of safety up to this point. The Tower has no door, it has no drawbridge. The crown on the top is a material belief that has kept you safe up to this point, and now you're just going, fuck it, I'm going to let it go. I've been on survival mode for probably about 5 years now, and I am starting to let go of that. So that really resonates with me. It is scary to think that there is potential and possibilities in my life, that I don't just have to work 12 hours a day and sustain my family, that maybe I could have a life in there. That feels right to me. And what I say with the Tower in a health reading is go with the flow, jump into the void, leap off. Whatever you're frightened of, dive into it. And the practical advice, the Queen of Cups, it's about spending more time engaging with my emotional self. I feel that I haven't given myself enough time to connect with my emotional self, and that I'm waking up at night to give myself time to do that. I think the Queen of Cups, it's a water card. It's probably connected with hormones as well. But I think in principle, I'm not giving myself enough time to process emotionally what I've been through. So that would really ring true. Now, if you're reading for someone else, if you're the tarot reader, it's up to you how you hold the space to ensure that your client is helped and not led into a more anxious space. At this point, we could draw another three cards for the future, or we could leave it there. And as a tarot reader, that's really going to be up to you to make that intuitive decision. If you feel that this has been hard for the person that you're reading for, if you feel that there's a lot to unpick, then you might think to yourself, I'm going to leave it there. I don't want to look at the future. I've acknowledged where they are right now, and I've given them practical advice as to how to support their health. We're not diagnosing, We are not stepping into the medical sphere, because I certainly am not medically trained at all. I'm here using the cards to give holistic support. Or if you feel confident, if you feel comfortable, then you could pull another three cards. The Eight of Wands, that would suggest streamlining my life. I like that. It would suggest that my sleep pattern will improve because it's a nice smooth card. Temperance, it suggests that my life is moving into a stage of better balance. And curiously, one of the things I've been wondering is when I wake up, usually at about 3 in the morning, is the best thing to acknowledge that I'm awake, get my journal, get my paint box, and use that as a creative time. That's what I'm thinking. And the Seven of Swords tends to suggest that to me. I think of the Seven of Swords in a reading like this as blue sky thinking, being original. This would suggest that I'm better off if I do wake up in the night, being original with it, making the best of it, not stressing about it, perhaps even going to bed earlier and seeing that as a creative time. So, give it a go. If I was reading for a client, and particularly, I mean, insomnia is not a particularly bad health issue, let's be frank. Worst case scenario is I can just go and get sleeping tablets from the doctors. I'd rather not, but it's there as an option. If I was reading for somebody that perhaps had more difficult symptoms, or perhaps they've already been diagnosed with ME, MS, fibromyalgia, anything like that, then I might not do the future spread. I might simply say, I am reading to understand where you are right now, and I am reading to give you practical advice for the future. I am reading for holistic support as to how you can support your health. And everything that I am reading is in alignment and to support and complementary to anything your medical healthcare professional is saying. And that's how I would structure a health reading for a client.